Hello everyone, welcome to the Rheumatology Physio YouTube channel, and I have a very popular video called Inflammatory Back Pain and Chest Pain, and I wanted to spend some time elaborating on that for all the people that have asked questions about that topic, and just to provide a little bit more information so that you know what is potentially going on. So there's a couple of components to this video. We're going to start off by talking about the types of chest pain that are directly associated with inflammatory back pain, and then we are going to go on to talk about what we might be able to do about it, because it is unfortunately quite hard to treat. So let's get straight into it. So there are two obvious types of chest pain that are directly related to inflammatory back pain, and these are costochondritis, and I'll explain what that is in a minute, and also inflammation of the sternoclavicular joint. So inflammation of the sternoclavicular joint is actually very common with types of inflammatory back pain. The most common type of inflammatory back pain is ankylosing spondylitis. There are some other types as well related to psoriasis or inflammatory bowel disease like Crohn's disease or ulcerative colitis, and they all roughly look about the same, except they just have slightly different causes. Now, sternoclavicular joint pain is pain between the clavicle or the collarbone and your sternum, which is your chest bone here. And there's a joint that butts up against that. So you've got two of them, and they're right there just at the base of the neck. And what they do is they actually rotate as you elevate your shoulder up in the air, so that joint rotates. Now, you can get a direct arthritis of this joint, and that's most common in people with inflammatory type back pains. So what usually happens is you'll get a very obvious pain over the joint, and quite commonly you'll get redness, swelling, and heat of that joint as well. So if you have that, then that's likely related to your inflammatory back pain diagnosis, and that, like I say, is reasonably common with regards to people who do get inflammatory type back pain. And it's also pretty unusual to get that through any other cause. So almost always it's related to inflammatory back pains. Now, the second type, and the more difficult one to treat, which we'll come on to, is costochondritis. Now, this is an inflamed joint where the ribs meet the spine. So as your ribs come around your chest, they attach into the spine again with a joint, and that joint moves as your rib cage expands when you breathe. Now, this is really quite a problematic issue, and again, very common in people with inflammatory back pain. Now, what you tend to get there is less of a specific pain like you do, like we talked about with the sternoclavicular joint pain, and more of a generalized sort of trunk pain. Is quite widespread usually. It's not a pinpoint area, and this because this can happen at multiple rib joints. And even with just one rib joint, the range of the pain is actually quite large. And you can imagine as the rib moves away and around the chest wall, that can take with it sort of that sensation of the pain quite a way around. So it can almost get right around to your side at times as well. So this, again, unfortunately, is quite common. The other problem with this is you can't really get at it. It's difficult to move on its own. It's difficult to sort of mobilize. You feel like, a lot of people feel like the joints are stiff and they want them to be moving or to feel better, and you just can't manage it. You can't, because all the ribs are moving together. Even if you try and move the spine, multiple segments of the spine are moving at the same time, and it is just a complete challenge to do. So you feel like you can't get away from the pain. It also is significantly aggravated if you cough or you sneeze, or if you take a deep inhalation or a deep breath. So if you're getting out of breath, or like it is when I record this video, if it's cold, that can be problematic. Or if you're unwell, or just get a random sneeze, you get a lot of pain because of that forceful contraction and movement of the rib cage. So this can cause people a lot of problems. It's also quite difficult to diagnose because of the widespread nature of the pain, and because of it coming on with breathing. You obviously are breathing most of the time, so the pain can be brought on by that at any time. So this can make it quite difficult for this to be diagnosed specifically. So those are the two types of pain that are related to inflammatory back pain. So let's talk a little bit about treatment. Let's talk about the sternoclavicular joint, so the collarbone joint first. That's actually the easier one to treat because you can get at it a little bit more easily. So a red hot swollen joint here, that's usually treated with something like anti-inflammatories, either orally via tablets, things like ibuprofen, diclofenac, naproxen are examples of that, or topically. So as a cream, you can put cream on there as well. If that's not working and it's not sufficiently reducing the symptoms for you, then a steroid injection is possible. So they directly put a steroid into the joint, and that is obviously an extremely strong anti-inflammatory, and that can help a lot. That's a less common way of treating it, and it is sort of not a last resort, but it's certainly amping up the level of treatment. The third and common treatment for this as well is if you are already being treated for whatever is causing your inflammatory back pain, then it's possible that either an escalation of the dose of that treatment or a change of that treatment is possibly a way to go as well to also treat that joint. Now, that sort of depends what you're already taking. So a lot of people will already be taking anti-inflammatories. So you can't take multiple of those, but you can change the type. Other people take stronger medication, often by injection, and these are often called biologic drugs. So that's a possibility that it might need changing, and it's definitely worth talking to your prescribing doctor about that. They will be able to give you much better tailored intervention to you specifically. There isn't a lot for professions like physiotherapists like myself or other musculoskeletal professionals like osteopaths or chiropractors. There's not a lot we can do at that joint if it's inflamed and red and hot and swollen. We can give you some advice. Things like using ice or warmth over the area can symptomatically help. It might even be that we can help you, give you some protocols on that to try and help. And if you're losing some range of motion or some function in your shoulder because it's painful in that joint to lift up, then some gentle exercises to maintain your strength, range of motion, or improve those as necessary can be helpful. But outside of that, there's not really tons for us to do. So then we can move on to the costochondritis. Now this is much more difficult. You can again use anti-inflammatories as we previously talked about, and the oral ones in this case do tend to work much better than the topical ones because the joint isn't so close to the surface, so it's more difficult. You know, there's a lot of muscle to get through in the back comparative to directly on here. So with costochondritis, the topical anti-inflammatories don't seem to work quite as well. The steroid injection is extremely difficult to get into that joint, so usually that's not an option. You can have it done. I have seen it done with, they're called ultrasound guided, so you have it at the same time as a scan. But as I already talked about, you can have multiple levels, and you're not going to have multiple steroid injections across multiple levels where the ribs are involved, so this makes that a lot more difficult. So steroid injections specifically to the joint tend to be off the table. If it's widespread and it's problematic, very problematic, then you can have a more general steroid injection. But again, this tends to not be used that much just because there are a lot of side effects associated with steroids, and the effect is a little bit short lasting. So you can't just keep having those. And so you might get a bit of relief for maybe a few weeks, up to 10 weeks. But then if the symptoms come back, you can't repeatedly have these injections over and over. So that goes down the list a little bit. So with costochondritis, much more than the sternoclavicular joint, what we're going to see is the changing of the other medications that are being already prescribed for the inflammatory back pain. So that might be a change in anti-inflammatories, it might be a change in the biologic, or an escalation from the anti-inflammatories up to the biologic. So that's usually the most common theme that we see to manage this stubborn costochondritis. Now, physiotherapy, etc., in this case has a little bit more to offer, and showing you ways of trying to increase your rib expansion is a really good option, and trying different ways of doing that, so faster movements, slower, larger movements, and so on and so forth, can be really useful to get the joints moving. Specific techniques around the area are a possibility. Now, my experience is some people find them useful and other people find them extremely aggravating. So typically the way that I see this going is a very, very gentle approach to that, something like a gentle massage over the area. And if that goes fine, then in subsequent sessions, maybe using something a little bit firmer. Now, the problem here is this is very short acting, but there aren't any real side effects. So it's short acting, and what that might allow you to be able to do is using those techniques with a physiotherapist or an osteopath, whoever, might allow you to breathe a little bit more deeply, do some of the breathing exercises to try and mobilize the area of the rib cage expansion, and that might give you enough, that might be sufficient to allow that to be more comfortable, and then you get into this exercise program and improve things. So it might just help you get over that first little bit of significant discomfort and go on from there. So there are some things that can be used. Again, ice and cold over the area might be symptomatically beneficial. And really, it depends on the individual. Sometimes it's warm, sometimes it's cold. Depends which one you find them that helpful. But those kind of things will, to a degree, help the costochondritis as well. So hopefully you found that useful and interesting. Two really tricky areas to treat when someone has inflammatory back pain. If you do have any questions, any comments, please do put them on the video and I will try and answer as many as I can. Subscribe to the channel, watch all the other videos. I've got plenty more coming, and hopefully I'll be able to answer your questions and help you to manage better with your inflammatory conditions. I cover everything related to arthritis, especially related to rheumatological disorders. So please do ask questions, get involved, and I'll see you out on further videos.